Assalamu alaikum, everyone, and good morning, good afternoon, and good evening, depending on where you're joining from. So, again, it's my honor and pleasure to welcome all of you to another of in the series of these APPNA MERIT Healthcare Research and Innovation Landscape in Pakistan webinar series. As you know, that we are now doing these webinars every 2 weeks. And so we are here again today with yet another very wonderful and accomplished speaker and a panelist. So I'll just first go through a brief introduction of Professor Zaheer-Ud-Din Babar. So we're very fortunate that he has joined here. He's a professor of medicine and healthcare and director of the Center for Pharmaceutical Policy and Practice Research at University of Huddersfield in UK. And he comes with a global experience of working as an academician in universities across the globe, not only just in UK. And he is globally known for his work in pharma policy and practice. He has published in several high-impact journals and acted as a consultant for multiple national, international, global organizations such as WHO and World Bank and European Union, and the list goes on and on. He's also an editor-in-chief of the BMC Journal of Pharmaceutical Policy and Practice. And he was kind enough to share his email also on the webinar flyer. So if you would like to contact him, that is there too. And then we are also joined by the two of our panelist here, and one of the panelists is everybody knows is Dr. Syed Uzair, who's the man behind the whole endeavor and needs no introduction. You have seen him several times. And then we're also joined by Dr. Syed Irfan Asif. So a brief introduction of Dr. Syed Irfan Asif, who's the panelist today, is that he has earned a PhD in organic chemistry from the International Center for Chemical and Biological Sciences at Karachi University, and then he went ahead and then did work at the Pharmaceutical Chemistry Institute at Heidelberg, Germany. He has experience in work in quality and regulatory sectors of pharmaceutical industries for over last 28 years in multiple countries around the globe. Right now, he is a senior quality consultant from Pharm Inc. Technology Incorporated in Toronto, and he oversees various quality-related projects at Sanofi Pasteur for their vaccine manufacturing site in Toronto. And he's, of course, author of many research publications, and he is involved in quality operations and GMP practices, and he has been involved in delivering lectures. He was here also giving lectures, but also at multiple universities in medical technology at in Toronto and elsewhere. So these are our panelists and the speaker, and we're also joined by Dr. Sarwat Hussain, who everybody knows. He's our regular panelist also. So just a couple of housekeeping rules before we go is that please keep yourself mute and video muted during the presentation. And if you have any questions, please put it in Q&A. Usually we don't interrupt our speakers, but if there is a question that we would like that need immediate attention, our panelists, Dr. Uzair and Dr. Syed Irfan, will be manning the chat and the Q&A. And then once the presentation is done, then we will open it up for the panelists for their take on the talk and the topic. And then if there are any questions, we will be happy to address those questions. So with that, again, welcome everyone, and I will hand it over to Professor Zaheer-Ud-Din Babar to please take it away. Thank you so much.
Thank you very much. Actually, for inviting me, and thank you to APPNA and also to Zersa for the wonderful invite, and it's a pleasure to be here this afternoon from the UK. Basically, this is a concept which is quite close to my heart, and I'm going to speak for about 15-20 minutes on this concept and usefulness of this concept, and how it's important to have a pharmaceutical university for Pakistan. And then perhaps there will be opportunity for the discussant to have some sort of discussion and some have some ask some questions as well. Um, Many of the things, I mean, argument in this commentary is basically based on having um, more roles for pharmacists in Pakistan, but then it also argues some other concepts related to how um, other healthcare professionals, doctors, nurses, scientists, health economists, how they could contribute towards and how they could benefit from such an exercise. So the way I framed this argument is actually it's built around medicines and pharmaceuticals because you know that why medicines and pharmaceuticals are important, and pharmaceuticals are a sort of a major intervention in the context that 80 to 90% of the healthcare expenditures actually in low and middle income countries are on pharmaceuticals. So if you say that if you're spending $100 on health in a low and middle income country, so you're actually spending about $80 to $90 on pharmaceuticals because you're actually spending more money on tertiary care services rather than on primary care. And it's a sort of a major intervention. So that's why you have this whole debate on how the pharmaceuticals are sort of a major sort of an intervention. These are health and medicine spending trends, and you could see that these are increasing world over. The expenditures on pharmaceuticals, they're increasing. And there are so many reasons that they're increasing because the people are living longer. They know more about their medicines, and you have chronic diseases which are actually on rise. So there are multiple factors that you could see that the health and medicine spending trends. On another argument, for example, you could see that in European Union, for example, half of the health budget nowadays is being spent on cancer medicines because the newer cancer drugs, immunologicals, they're so expensive. So you have medicines which are actually at the cornerstone of any healthcare system in the world, whether we talk about high-income countries or whether we talk about low and middle-income countries. So you have a sort of a collective argument about health and medicine spending and trends. And I just want to show you this very interesting slide I have is actually the contribution of medicines in terms of the morbidity and mortality indicators. For example, the cardiovascular disease fell by 30% in rich countries where the people have more access to medicines as compared to the poor countries, low and middle income countries, where it fell by 9%. So you could see a significant impact of pharmaceuticals on health. So it's a powerful slide, which actually could show you that if you use your medicines properly, if you have access to necessary medicines, then it can impact on the health outcomes and it can improve health outcomes in society. So this is the kind of argument about medicines, but looking at the situation of medicines in Pakistan, I'm sure that all people who are listening to me, they have an interest on medicines, pharmaceuticals, whether they're doctors or pharmacists or other healthcare professional. I don't really have to go into details, but someone who has been working on looking at pharmaceutical issues in Pakistan for the last 20 years, we know the problems there are. For example, irrational use of medicines. Pakistan is one of the top countries in the world where you could see injection practices. Prescribing behavior is the question mark. These are not only few issues we have, but there are also other problems. For example, the policy space, you may have heard about how to set medicines pricing, how to regulate. There are issues which are related to safety of medicines, the quality of medicines, whether we have good quality medicines available or not, whether you have affordable generics in place. And then, of course, you have a whole lot of debate on development of pharmaceutical industry status. Where do they stand? There are also other issues, for example, the regulatory perspective, consumers' perception. So we have kind of a mixed bag of all these issues. And the problem is that when you actually touch one issue, It's really difficult to solve, actually, to not to go to another step before basically looking at the first issue. And this is someone I'm saying as having a first-hand experience of developing Pakistan's, in the process of participation of the development of Pakistan's national medicines policy as well. So where do we start? There are different ways, and I'm sure there's a lot of brilliant work going on in Pakistan. And if you look at the last 20 years, you would see basically that a lot of publications have come up in pharmaceutical policy and practice space. 20 years ago, we didn't have few articles from Aga Khan University or a few other places. Now you would see hundreds of research articles coming up. So there is some sort of development and things moving, basically. But in this whole thing, how developing a focused pharmaceutical university can sort of help in this direction. Though we have the different isolated segments, people working in different areas, but there is no sort of a concrete critical mass or a one-stop sort of center which could establish a sort of stronger workforce. So these are some ideas which I put forward, that how a pharmaceutical university, if you have a national pharmaceutical university in the country, how it could help actually to develop as a think tank or a strategic center to look for some of the priority research areas, cutting edge research on the topic, to train workforce, because I strongly believe this pharmaceutical university is not only for pharmacists, but also for doctors, for scientists, for public health professionals, health economists. The only thing which could be common among all these people is basically pharmaceuticals. Whether you talk about access to pharmaceuticals or medicines use, this could go into both ways in this. Pharmacists could come as a sort of, in this as well. This is a group which is the third largest healthcare professional groups around the world, globally, after doctors and nurses. WHO actually recommends one pharmacist for every 2,000 people. Pakistan needs about 115,000, even more than that, actually, the numbers we have. But we do not have those sort of numbers in Pakistan. So there are challenges and issues. And if you do not have the professional capacity, this would limit in terms of their contribution to improve healthcare. So there are different sort of roles. I'm sure you know all these roles for pharmacists, whether they're community pharmacists, hospital, industrial, Ministry of Health, Research and Development, academia, and international agencies. And the reason I'm showing this slide to you, because in most developed countries, or even middle-income countries, because I have worked a lot in middle-income countries as well, you would see that 90% of the pharmacists are engaged in primary care, which are the community pharmacies. And this is a sector which is a sort of an underdeveloped sort of center. So if you have a pharmaceutical university, it can help to provide some strategic guidelines and policies, because one of the issues we have is actually the leadership and providing the informed guidance to the legislators and policymakers in terms of their role. And I'm not advocating the role for the professional roles of pharmacists. I'm advocating it for more sort of to improve the health outcomes, because world over we have seen that community pharmacies and community pharmacists have played a very important role in medication adherence, patient counseling, all sorts of things where patients can actually easily access the medicines. These are the role integration in a spectrum of low and middle income countries, and we have seen that in COVID as well. And even in UK, we have examples, not only in UK, New Zealand and Australia, even in high income countries, where they have played an important role. But also, as I said, not only high income, but like middle income countries, like Malaysia, where I've worked, Brazil, Turkey, where you could see the pharmacist effectively promoting healthcare. So how you see that given the strong universities and health system can produce professionally competent health, health workforce to promote medicines access and use. And we have seen examples, for example, in China, there's a China Pharmaceutical University. We have in India, there are examples. So the India started this, what is called NIPA, National Institute of Pharmaceutical Education and Research, which is based in Chandigarh state in India. It's called Mohali, the name of the city. And this center is doing wonderful. They have producing PhD students, and the success of this center emulated to actually bring up 3 or 4 more centers similar to NIPA in India. And they were dedicated research centers. So they're doing research on pharmaceutical drug discovery, development, and also doing research on policy side of things, what we call it pharmacy practice and policy, and developing guidelines on all sorts of issues, basically. Not only, as I said, only in middle-income countries, but also you would see that trend in high-income countries as well. There are countries which were newly emerging economies, such as Vietnam. So they also have universities which are related to pharmacy. But unfortunately, in Pakistan, we are the 6th most populous, 5th or 6th most populous country in the world, with the population number increasing. We do not have any such university. So this is the concept note, which I wrote many years ago when I was based in Malaysia. And some of the things which I'm presenting today are based on this paper. If anyone is interested to read the full paper, I'm happy to send a copy of that paper. So this could, as I said, can cover the training needs of not only pharmacists, but also anyone who is working in pharmaceutical sector or who is interested to work in medicines, access and use. Drug development could be one part of it. Basically, and it's an important part, as you currently know very well, that we do not produce any innovative medicines. But that's fine, because a large number of countries do not produce any innovative medicines. Only very few countries, European Union and America, produce innovative medicines. But then some countries, they actually bank on they conceptualize on their phytochemistry and their indigenous plants and things. So I think we could maybe, if not all, maybe could have a direction in that sense as well. So there's a list of things which I actually put in here, ranging from manufacturing to phytopharmaceuticals, improving rational drug use, producing empirical data, reforms, policy. But one of the most important thing is actually, which I have actually realized over the years very strongly, that even the lawmakers, the regulators, and the decision makers do not have appropriate guidance in terms of the medicines, policies, and laws, and anything similar to that. So that could develop as a sort of a think tank to develop the policies, basically. Also, it could, cover some of these issues, which I said, on the United Nations Sustainable Development Goals, which are on the agenda. Also, it could lead and link up with the other universities in the country or research centers in the country. And many people actually, because when I previously have this article, they asked about questions about the existing centers in the country. And I think we are such a big country in terms of population that we need more of these universities. So even if we have multiple universities, it's going to fill up, because our needs are unlimited in terms of human resource. Look at the numbers we have. I'm sure there are very expert people who are listening, and also in this forum, who are medical doctors. They know very well, better than me, in terms of epidemiological needs of the country, the number of diabetes patients we have, or hepatitis patients we have. So I think in terms of healthcare institutions, we need more institutions, not only in numbers, but we need institutions which are of good quality. So what I'm advocating here is not only the number, but a state-of-the-art institute which could help. And there's a kind of a diagram which I sort of developed, and this could be developed further. This could be elaborated, but I put it how this university can work together with the international agencies, with pharmaceutical industry, or with the consumer groups, patient organizations, Ministry of Health, with other educational institutes, with the regulatory bodies, so it can actually sort of spin off with all these things. Though it's a big concept, but everything starts with an idea. So I thought of sharing this idea with you. This is, of course, a huge task, but I'm happy to share this concept. And I hope that one day it will come to fruition. So thank you very much for listening to me, and happy to have open for discussion. Thank you once again for inviting me on this forum.
Thank you so much, Professor Zaheer-Ud-Din Babar, for a very succinct and you put like a lot of information in a very brief presentation. But let's open it up for our panelists. Dr. Syed Uzair and Dr. Syed Irfan Asif are here, please, for your comments.
Thank you very much, Professor Zaheer, and for thought-provoking discussion. Before taking the question, I will request Dr. Syed Irfan Asif really to highlight the importance of the topic and, just share his views about this National University of Pharmaceutical Sciences.
Thank you very much, Dr. Uzair and Professor Zaheer-Ud-Din Babar. And in fact, actually, in a very short time, you have really covered a very, important topic. It's very significant, and I'm so glad to see all the statistics actually in this presentation. And I kept thinking that in last couple of decades, there has been some development in Pakistan in terms of health sciences. Like we have seen actually a lot of universities erupting like mushrooms, and they were all offering like health sciences education as well, which includes pharmacy education, that they actually have gone a stage up to like a degree of Doctor of Pharmacy, PharmD. And I have also seen that approach. There's a change in the approach. Like now the hospital pharmacists are actually developing there, and the retail pharmacist concept, which was actually not being practiced actually in Pakistan for so many decades, is now actually in practice. However, the need of a typical, a university typically for pharmaceutical sciences is definitely a need of time. I have seen actually that the two important things, one of which actually you have mentioned in your slides about the need of university. Why do we need that? One of those two are actually like R&D. Okay, ICCBS has been doing some work, like research work in this like health sciences field. However, I do not see a very critical, or very significant, or very concrete, step taken in this regard. So R&D is something that usually is actually lacking in Pakistan pharmaceutical industries. R&D means that you simply develop a molecule which is already developed somewhere in another part of the world, and then you just tweak it a little bit, and then you reorganize things, and then you develop it and make it according to your own environment and your own, manufacturing conditions, and then produce that in the market once the patent is expired. But there is no such effort in developing the molecule itself. And on top of that, the other point that I think is critical, and we must touch it in this whole discussion, is the production of raw material. As I said, that I have seen significant development in the field of pharmacy practice, I would say in general. not just like in terms of education, but also in the industries. Yes, we are way behind in good manufacturing practices or implementing the regulatory standards with its, epitome. But the production of raw material itself, the important, significant, critical molecules that we have to buy from outside market to develop, and that actually is one big reason for the price of the medicines in the market. So what is your opinion on this? Like, R&D plus production of basic molecules. We only produce 10% in Pakistan, and we buy almost 90% from outside the world, compared to India, where we see that 70% they actually producing on their own, and they are actually buying only 30%. Of course, it's a big country. There's a lot of resources there. Pakistan lacks resources. But yeah, R&D with the manufacturing of or the production of important molecules. What is your opinion on this?
Thank you very much, Dr. Syed Irfan Asif, for your thought-provoking comments and questions. In fact, this idea note, which I wrote many years ago in National University of Pharmaceutical Sciences, it does mention the center in Karachi in terms of development of things. I think you have raised two very important points, but the answer to that is that it's difficult to have a comparison with India but having said so, it's equally good if we could produce more. But producing more does not mean that the people would have access to medicines. I can give you one example. India may have a very strong pharmaceutical industry, but 40 to 50% of the essential medicines in Indian public hospitals are missing. So you could have a very strong pharmaceutical industry, but it does not guarantee that people would have access to medicines, and they would have access to what they need, number one. Number two, on the other hand, some countries like New Zealand, they have no pharmaceutical industry. They have only one generic pharmaceutical industry, but they have 100% medicines available in the hospitals. That's one point. If we actually link with the strong pharmaceutical industry, with having the access to medicines and availability in the country. But having said so, the kind of challenges our pharmaceutical industry has faced, I think, in those circumstances, I think more or less they're doing a good job. Though, of course, there could be some industries where you can say that the quality of medicines is questionable, but then we have some very good pharmaceutical industries in Pakistan as well, who are producing good quality medicines and also promoting. So the WHO, they have policy which is called local production of pharmaceuticals. In fact, WHO in Geneva, they have a separate department which actually provides capacity building to low and middle income countries. And it's called local production of pharmaceuticals. So they help many African countries to develop their own capacity based on many reasons, because of logistics, because of supply chain. But then many of these countries, they have poor procurement. So they put up their resources together and buy together from UNICEF, from WHO supply division. So they think that it's actually more cost effective to buy the bulk buying rather than to produce the drugs in their own country. Just in one line, I think the answer is that it is good for Pakistan to have a local pharmaceutical strong industry for many reasons. It's good to have an innovation, some sorts of innovation, but I think we cannot be unrealistic here, because innovation currently is only in Japan, which has its own pharmacopoeia, or in European Union, Switzerland, UK, Germany, France, not in all Europe as well, and also America. So there's less than 10 countries in the world which has a very strong pharmaceutical industry. Other than that, you all have our importers or drugs. So that's my sort of, answer to that. But even though this university can help develop some policies to bring the people together, because I think the problem is that we need people who can think and can put these policies in place, and then can actually go to the decision makers with sort of informed advice. Because I think many of the policies which are being done may not be based on the evidence informed or research or that sort of things.
Thank you very much, Professor Zaheer. Now we move on to the question answers. The first question is from Mr. Tahir Bashir, and his question is that DALY improved. Excuse me, there is a little bit noise. Can the other gentlemen mute themselves? So the question is that DALY improved more by lifestyle and less by medicine. So what's your comment on that? So he's asking about the role of pharmaceutical vis-a-vis with lifestyle. So that's the first question.
How do you see I did not. It is DALY. What is DALY?
Yeah, that is the disability life adjusted year. So that is yeah, that's the parameter. So the question basically in a simple term is that we emphasize the role of pharmaceutical in healthcare delivery. So his question is that if we compare the role of pharmaceutical vis-a-vis with the environmental factor like lifestyle changes, so that's more paramount really. So what he would like to ask your comment on that, comparing the intervention of pharmaceutical versus the lifestyle.
Thank you very much. Again, I think I showed the second slide in my presentation. So there was a slide which was showing the role of pharmaceuticals. That actually, if you have the cardiovascular disease fell by 30% in high income countries where the people have more access to medicines. And it only fell 9% in low income countries where less people have access to medicine. So my argument, of course, lifestyle modifications and all these things are important. But I think having medicines, taking your medicines properly is very important. This is another area, I think, in Pakistan, the information sharing. I think we have sort of lost the debate with WhatsApp group, where all sorts of misleading information is shared. We do acknowledge the fact that having good lifestyle advice is important, but I think it's also important for people to realize that there is no substitute for medicines. So please take your medicines properly. These are equally important to improve patient health outcomes and all that. And we have, I mean, huge amount of research, Cochrane evidence. I'm sure there are a lot of people here who would understand what Cochrane evidence is. And Cochrane evidence.
Oh, Professor Zaid, you look like frozen or muted.
No, I think his maybe what has happened is that his internet connection got disrupted.
Disturbed.
Yeah. But maybe I think we can since Dr.
We can continue.
Khan is here, and we can.
Continue with Dr. Syed Irfan. So, Dr. Syed Irfan, my viewpoint about this is because we have the another Kamkolian, Dr. Sarwat. So that remind me, we had a professor of medicine, Khwaja Sadiq, and he used to say that Pakistani population is being drowned in the ocean of multivitamin, but lacking the real medicine. So again, that highlights the importance of taking the right medicine. People are very much concerned about the nutraceutical, the minerals, all those stuff. But of course, there are a lot of cultural factors. They say that some of the, particularly like the dosage form, the capsule, they are hot. So that's the Pakistani culture as compared to syrup, which is much more palatable and, having tasir thandi, something like that. So there are a lot of cultural stuff which is going to affect the consumption of pharmaceutical and when comparing it with the other thing. So I'll ask the second question to Dr. Syed Irfan, he may highlight. So that's the question from Dr. Suhail Manzoor. So his question is, we have a lot of challenges, but more opportunities for doing good. But who can initiate the right change? The idea of a think tank having all stakeholders can be first good steps to get the right people to start work So that's the question. Either even Professor Sarwat, I think that's quite an open question. Even you can
I can
respond
just
to it.
add a two cent on this. I can add two
Yes.
cent on this, Dr. Zaheer. You actually have raised a very, very good point here, Dr. Manzoor, whoever the name you just mentioned. Well, it's really true, and it's very unfortunate. And I think this is one of the points that was actually indicated in Professor Zaheer Babar's slides. And one of the point was prescription behavior. And I will just add up with this prescription behavior, the unethical behavior as well. So this is very these days. We have seen a very fast growing usage of nutraceuticals and the prescription made by doctors. And the only there should be a point, and I know that all the pharmacists, like the doctors, they go through a kind of like an oath or something where they are actually bound themselves to practice the ethical values. But often it was neglected. It is being neglected. So I think the regulatory bodies have a very critical role here to play, and DRAPE should come forward, and they should actually, okay, welcome back, Dr. Zaheer. So DRAPE actually has got a critical role here to play. The only way that we can really make some kind of like a strict implementation of the rules and regulations so that the ethical values are being practiced appropriately, and the prescription behaviors could be changed, and the patient can really take the real medicine that he actually is needing. So you are right that we are actually down in the ocean of multivitamins and minerals, but not the life-saving drugs, which is like more important and more critical. Maybe you can just briefly ask the question again, so Professor Zaheer can also put some light on it. But I think regulatory bodies have got a role to play here.
Thank you very much, Dr. Syed Asif. So, Professor Sarwat, unmute yourself and please share some of your views.
Gee, thank you very much. It's first of all, congratulations to APPNA MERIT to invite someone like Professor Zaheer-Ud-Din Babar, whose library behind him is filled with his own books. And I think that's exceptionally impressive. I have tremendous amount of respect for Professor Zaheer-Ud-Din Babar, not only because of his name, the royal name, but also what he has done so far. Now, my question for Professor Zaheer-Ud-Din Babar is, obviously the topic is about the Pharmaceutical University, and Pharmaceutical University is not only a conceptual model at this time, but also has a certain components, it's like a Lego set. You build something from its portions. Now, step by step, I would ask Professor Zaheer-Ud-Din to how would the concept start from what already exists in the country in terms of pharmaceutical association, pharmaceutical educational program, pharmaceutical colleges and universities and programs, and obviously biochemistry is part of that, which includes JEC, Chemistry Institute in Karachi. So all that, how would you, given what is available, build the case for university to make it a reality?
Yeah, I think thank you very much, Dr. Sarwat, for your kind remarks, encouraging remarks. I think I've explained this in my presentation as well, that of course we have structure in place. But the aim of this university is not to have another university. It's not a quantitative change. It's not looking for a quantitative addition of another sort of one thing, but it's more sort of qualitative, because though you have, but currently in pharmacy sector, the pharmacists have no say in the decision-making process. Their voice is not heard, and they're not, they're not elite class policymakers. So you don't really see that they are part of the decision-making process, though they are in the custodian of healthcare, as far as the pharmacist is concerned, the medicines. But they are not really in terms of presenting So one of the things which this university could do is to have a network and to network all these institutions, which are, of course, and all these pharmacy institutions in Pakistan, they are doing brilliant work. But one of the biggest things, as I again said, is to have a policy making work, whether it's in terms of pharmaceutical industry, whether it's in terms of medicines use and access, because the dimension of this university is not only for drug discovery or biochemistry or pharmaceutical industry, which is equally important, but I think there is another dimension of the medicines pharmacist work, which is in medicines access and use. So medicines use is all about prescribing behavior, rational drug use, all these sort of things. And I can give you one example. And medicine access is, for example, medicines pricing policies. We do not currently in Pakistan have any think tank which can develop pricing policies. If you look at HEC, a couple of years ago, I have a chance to look at, they have a call for research. And I looked at their about 300 to 400 of their research proposals. And none of them were actually looking at these important things, such as rational drug use, prescribing behavior. How do we improve the practices? How do we improve the rational drug use in the country? So it means that there is no guidance at the top of the top. So one of the most important things for this university is to have some sort of representation at the top decision maker. I can elaborate what I'm trying to say. The countries where we have seen the change in terms of pharmacy, in terms of medicines use, we have seen that the decisions have been taken from the top. The decisions have been taken at the level of prime minister or the minister or the president to make a change. In many of these countries, we have seen that the people who are making the decisions are either pharmacists or doctors, means that what I'm trying to say that in Malaysia, there was a health minister or education minister who was a pharmacist. So these people can actually make those change, because the change is not only, but who is saying what, at what level. So what I'm saying is that we lack representation in terms of putting forward some of these ideas. This university can basically help to advocate some of these goals.
Thank you.
And in the slide which I was trying to share, I think I'm happy to share my article with you. So it has a diagram, and it actually sort of link up the university in all sectors, whether they are pharmacy institutes, whether they are Ministry of Health, regulatory bodies, pharmaceutical industry, or international organizations.
I think Dr. Zaheer,
Yeah, I
Professor
think there is a
having some
yeah,
issues.
Disruption. Still, we can continue with the question. So, Dr. Irfan, so please, can you respond to this question? There is someone commented that if there is any such university, what type of examination should be the preferred one, like the semester system or the multiple exam, test, assignment, or a typical annual system? You know, comparing the semester system. Yeah, so that is an academic question. So if you would like to comment.
Interestingly, I was also looking at this question. Interestingly, I was also looking at this question. I was just thinking to answer this, but good that you already asked this. I'm a fan of actually a semester system. I've always been a fan and supporter of semester system that keeps you actually, or that kind of like forces you to read more thoroughly throughout the year, and do not let any stone unturned during your studies. And but the annual system itself actually puts a lot of pressure on the student. That is what actually I have noticed, and because I've been a student in my era, actually, when I was doing my university, we were going through this semester system. Actually, this was already started at that time, and that has always made us, study more thoroughly, more deeply, and almost throughout the year, keeping us busy. So it always gives you more opportunity to study, in a more detailed way. So I support that. And that is what I think most of the universities in Pakistan these days are actually working on, semester system, not annual system. Are they? Is there any? Probably
I
not.
have, yeah, we have to check it. So the next question from the same gentleman is that there is a suggestion to have the 1-year residency after pharmacist post-graduation and post-graduation exam for licensure, which is totally missing in Pakistan. Will it help improving the standard of pharmacy graduate that are going to join the healthcare? So would
There
you
is
like
no
to cover?
doubt that yes, it will actually, there is no doubt it will enhance the the standard, but I think it is already in practice, maybe not for a complete year, but I think most of the pharmacists or the pharm.D is, I mean, they're coming out of the universities, they are going through clinical practices and they are doing this kind of like internship, or you may call it residency or whatever. It may not be for a complete year, I'm not sure, I have to find it out, but yeah, that's a good point.
Yeah.
That's a good point.
So,
I support it. Yeah.
oh, excellent. So the next question is Dr. Suhail Manzoor from Karachi. My view, pharma academia collaboration has many stakeholders and not only pharmacist based. So Pakistan needs a think tank, just Professor Zaheer-Ud-Din Babar was mentioning, with all doctors, pharma industry, pharmacists, policy makers, independent and government sector, which is least aware of policies, need to be educated. So I think that this is a suggestion and a comment. Again, the next question from the same gentleman, Mr. Ahmed Raza. What about institution with zero quality already in system? Won't they compromise the overall standard of pharmacists being graduated every year, even in the presence of standard university like National Pharmaceutical University? So do you have anything to add
Okay.
on? Professor Zaheer-Ud-Din
So
Babar,
this is
are you?
the, if he's there, Professor Zaheer-Ud-Din Babar is
No,
not
I
there
don't
yet.
see.
Okay, yeah.
Yeah.
I can,
So,
it's a general behavior. It's a general behavior that we observe in the country, and there are, and as it is said, there are a lot of stakeholders. I don't know how we are going to implement a system in the country where everything is being done on very conscientiously and very honestly. The universities, if they are getting the charter for, they are approved for providing these type of like postgraduate studies, they have to be, it depends a lot on them. But again, how the system of education could be, enhanced in Pakistan, this is a question actually, because I see some of the universities who are doing good business. Actually, I'm sorry to use the word business, but of course it's a kind of like commercial thing. Private universities are doing business, but yeah, they are also providing good education as well. I mean, if I'm not restricted to, I mean, name a few like Bukai University or Zaheer-Ud-Din University. They're all private universities, but they are providing good education to the students. They're even going through the PhD degrees, awarding PhD degrees to the students. But yeah, there are some universities where the quality is very poor. I think the education system in Pakistan, and especially the regulatory bodies, they have to take action on this. Probably they have taken action on a couple of institutes like that. There have been some kind of like ban imposed on some of the universities of late. But that is the only thing that we can, expect in the country, or we hope that that could be done to improve the quality and make sure that universities do not produce low quality graduates and low quality studies education.
okay.
Yeah, that's
So
all I have to
Professor
say.
Zaheer, thank you. Professor Zaheer-Ud-Din Babar, we have a very promising pharmacist from Pakistan. She is very active. I'm sure you may be familiar with her. Her name is Huma Rashid. So she has a long comment and question. So pharmacy is one of the most underutilized profession in the country, which can deliver from the technological manufacturing for areas from conventional medicines to bio diagnostic, which are already imported in the country. The exact need of the country are never given due importance like that of the need of raw material production. So as mentioned by Dr. Syed Asif, self-sustainability, lacking in coordination and long-term policy over different areas, the absence of clinical services of pharmacists is altogether negligible on per capita basis. Hence, a separate pharmaceutical university is very important and crucial that synchronizes the need of the country and develops a futuristic plan to see the professional multifaceted development in concrete form. The University of Veterinary and Animal Sciences is one big example that how recently founded university can produce significant impact on a sector and a professional pool. And that's really the comment and her views. Similarly, introduction of medical universities in the country has already strengthened the medical education. So as you were mentioning, on the per capita basis, we have like dozens of medical universities, but unfortunately there is no pharmaceutical university so far is there. And we need to have, over 115,000 pharmacists. So she continues, individual institution working under the ordinance that does not target the interest of their profession is retarding the much needed growth. Having a professional university like engineering and so far pharmacy will safeguard the interest of the profession as well as develop comprehensive long-term plan and would see beyond the survival of an individual institute. The disciplinary specialization of the pharmacy is humongous. So that's basically her suggestion and her comments about if we go and move in that direction, what should be the strategy and how to address the different sporting and contrasting issues. So again, once again, I'm really surprised you are on the board of WHO and many more organizations. So I don't know why it was not realized. Like we have the engineering universities, we have the a lot of medical universities. I was amazed really. If you start from KPK, there are many, and if you move on to Punjab, so all the public sector med school, they have been converted into medical universities, Rawalpindi, King Edward, FJ, Nishtar, everyone. And but there's no such move towards the pharmaceutical, which is, I think, one of the most important component in healthcare delivery. Like the leading cause of death, even in North America, are the issues about the drug selection and about the drug dispensing. So in our country, where the doctor, they write the prescription manually and it's hardly legible, number one, and then you take that prescription to a medical store, and over there generally the people are either middle class or hardly literate people. They read that prescription and the brand, they are so similar, they sound similar, and however the molecule, they are entirely different. So the drug errors, so that's could be potentially the leading issue in Pakistan. So based on your experience with a lot of other countries, because that is the policy related. If we change the policy, yes, we can address them. So what's your feel on that really about the drug errors and the situation in Pakistan and the level of policy in place?
Yeah, I mean, as I said, thank you very much, and sorry for the disconnecting internet. It has never happened, and then now it has happened twice. I think what I'm trying to say is that this National Pharmaceutical University is not a panacea for everything. Of course, it's a one step to move towards the right direction. This is what I'm trying to say. And having this policy about, everything is in the drug laws, but I think it's in terms of implementation that we have loose implementation of laws, which is the problem. For example, it's not only the doctors. For example, if you look at pharmacies, we have issues that you can get, I mean, majority of the medicines you can get without prescription. And this is not only Pakistan, but this is in many low and middle income countries. You would say the same situation, whether it's Egypt, whether it's Colombia, whether it's any other country, you can get medicines without prescription. So it's a whole health system strengthening approach. Dr. Izar, you have asked a very right question, but I think it's a different people working together. It's not only the responsibility of one sectors, which are doctors, it's also the responsibility of pharmacists, doctors, pharmaceutical industry, regulatory bodies, and government. Everybody is moving in the same direction. Then only we can solve or approach some of these things. So the universities like this could help us to develop a critical mass of the researchers, like what we are talking about today, to build up some sort of, some sort of documents, some sort of legislation, something to put forward to the way to move, which direction to move. And again, I would say that in Pakistan, there are a lot of good medical schools. There are a lot of good pharmacy schools as well, where hardworking people are working. So I'm not trying to say that actually we do not have anything and we want to create something new. I think we would like to create something which is basically could create the awareness about this whole things about pharmaceutical. And I said in the start of my presentation, the first slide, that why pharmaceuticals are important, because 80 to 90% of expenditure in low and middle income countries are on pharmaceuticals. That's why you need to have a pharmaceutical university. Because if you're spending $100 on health, $80 to $90 you're spending on pharmaceuticals. Whether this expense is coming from people's pocket, majority of this expense in Pakistan is coming from people's pocket, or whether it's coming from the government sector. It's an important part of the healthcare system. And how do you approach this important part of healthcare system? You cannot just approach through WhatsApp group, through sunai batein. You need to do some hardcore research evidence behind it. And for do that, you need people, workforce. And how do you develop workforce? You need institutions to develop it. Thank you.
Okay. Yeah, we have another question from Professor Akhtar Hamid from Toronto. How about education and awareness drive quoted, choosing wisely in prescribing medicines in Pakistan? So that's just the, a loose question, nothing to do with university, but this is, his question.
No, absolutely. Sorry, you want me to say something?
Yeah. Please say something about prescribing medicine in Pakistan, education and awareness drive, and its impact in the Pakistani society.
Yeah, I mean, the prescribing, one of the most important thing in prescribing in high-income countries, and I'm sure that many of audience are coming from North America, Canada, and other parts of the world, is the availability of medicines. Because if you do not have medicines available, you can control it, whether it's rational prescribing or non-rational prescribing. But then we have another point in low and middle income countries, because if you control it too much, people would not have medication. So the self-medication has both sorts of arguments. So I'm not trying to say that self-medication is equally, good. It could be equally bad as well. So there are arguments on the both sides. But you need to control it up to the level, because prescription drugs are not like any other commodities. And there are other issues. For example, I'm sure you know very well, and I've not touched those issues. For example, antibiotic resistance. You can see there's a huge problem in Pakistan. And one of the reasons we have this problem in Pakistan is because of the availability, very easy availability of antibiotics. So when these are easily available, anybody can use them, and use them even for viral infections or respiratory tract infections where you do not need antibiotics. These are self-limiting infections which could be treated. So I think availability of medicines is a far more bigger issue. And because you do not have pharmacies which are manned by pharmacists, because anybody can open a pharmacy and you can have all sorts of medicines available, this makes the task of the doctors, I think, much more difficult to govern and manage, because whatever you can prescribe, people can just go and buy medicine and can take them without even prescription.
Yes. So,
Thank you.
Dr. Sarfraz Asni, I think this is the time you should please formally say thank you to
Yeah.
everyone and close it, please.
Yeah. So yeah, thank you so much. We are a couple of minutes over our time, and I know that there were some other questions, and I believe somebody was raising their hands to ask questions also. But I think Professor Zaheer-Ud-Din Babar has very generously and kindly shared his email. So if you have any questions or you would like to have more discussions, I think it's with your permission, it's on the flyer, so people can email you and continue this very lively and important discussion. So again, thank you so much, Professor Zaheer-Ud-Din Babar, for very valuable insights and looking at things at a very macro level, at a policy level, at how we can sort of turn the tide and make a difference instead of at a micro level that a lot of time we end up talking. So very insightful comments, very insightful talk and discussions following that. And at the same time, Dr. Syed Irfan Asif, thank you again for your time and your comments and for providing your insight into a very lively discussion. And as always, Dr. Syed Uzair is there, and Dr. Umar Hayat is here, and Dr. Sarbat is also here. So all of them, thank you for the panelists. Thank you for, and the tech team, of course, Waleed and his team is always there and very punctual and right on the dot. So cannot thank enough. And then all the participants for joining, and we will come back with another webinar in the series in about 2 weeks. Dr. Uzair, right?
Yes. Yes.
All right.
Yes.
Okay. With that, again, thank you on behalf of APPNA MERIT Committee to all of you. And we'll see you, inshallah. And
thank you very much.
Thank you very much. Thank you.
Thank you, everyone. Thank you very much for this opportunity.
Thank you.
Thank you, Irfan.